Welcome back to another episode of We Talk Fit.
With Mish and Dean.
You got your mic. Cool.
Easy peasy.
So,
Guest appearance.
I'm pleased you're sharing that stool and not mine. Small space.
Small butts.
So we're going to follow on from what we chatted about last week.
Mhm.
And
Myths in the fitness space.
so our myths and just trying to break down statements, I guess, would be the other way of looking at it.
Yep.
We touched on, some of these things last week. We'll try and elaborate a bit more today, but then we had a list of ones that we wanted to work through. So the big one that, it depends how it's worded. I wouldn't word it the way this is on here for us, but this whole one about, can we just do like abdominal work today, or can we just do abs today, or what experience have you had of that with clients? Or
Tend not to have that as much anymore. It's not as prominent, I suppose.
yeah,
Maybe because when I do my consultation and everything, when I first chat to anyone, it's we can't spot reduce. We'll have to work on this, this, and this to be able to get this result. And
yeah,
this is how it works. So I tend not to get that as much as what I used to. But just a lot of people think that they can just do ab exercises and they'll get their six pack. And it will show.
yeah.
Used to.
Mm-hmm.
Essentially. Same with.
I suppose this leads us into the whole core conversation as well.
Mm-hmm. Yeah, true. Have you had much with that one?
Not really. Most of the conversations I've had about abdominal area would be around core.
Mm-hmm.
I need a stronger core. So then I'm looking at it from a functional point of view rather than an aesthetic point of view. But a little side note is that you'll often get clients, and it can be the same with other body parts or groups as well, is they'll go, oh, can we do abdominal work today? My legs are too sore or whatever. And obviously we listen to clients and stuff, and we don't want you getting hurt, but sometimes they feel that it might be an easier way out than doing other exercises. So be aware of that.
Mm-hmm.
Abdominal work specific to core, is not easy done properly.
Core is neck to hips. It's not it's not abs.
The best example I can think of with core work, more specific to like the front, the abdominals, is like a leg raise. So how many people do you see doing leg raises? Lying on a floor, lying on a bench, doing leg raises. And they can do them till the cows come home. They can do, 50 reps or whatever. I often see people, not even clients, and I'll go over and I'll set them up and I'll say, right, okay, lie back on the floor, push your lower back into the floor as hard as you can. Keep the lower back there. I do not want to see any arch in your back at all.
Mm-hmm.
And then all of a sudden, they were dropping their legs to the floor and bringing them back up, and now they can only get their legs to here.
Yep.
Before their back arches,
mm-hmm.
their pelvis tilts,
mm-hmm.
and then they can go to the floor. So they're learning that they're not training their abdominals at all. They're actually just moving their pelvis up and down.
Yeah, or often, for that one in particular, I often put a towel, like a gym towel down, or even like a booty band essentially underneath their lower back.
Yep.
And I'll go, right, I don't want to be able to pull this out.
Perfect.
That's what I want. And then they're like, oh crap, that's really hard. I can't actually do that.
Or you get that same exercise and you say, right, go down, lower your legs down towards the floor until you get to the point where that back's going to arch, where you could pull that booty band out or whatever, and stop there. Don't go any lower. Don't let it arch, and get them to hold there for 20 seconds. And then ask that person if that's easier than training legs and shit, because it isn't.
Yeah.
Sorry, I might have to censor the language a little bit today if I've got you next to us.
No, it's fine. It's fine.
Yeah, so that's training things properly.
Yeah.
Rather than going, okay, I'm going to do some sit-ups and a couple of planks because it's easier than training my legs.
Yeah.
So I just want a side note on that one.
Yeah, when you do it properly, it's hard. When it comes to core, though, I get people to learn, because a lot of people get lazy, clients and stuff that I've had, will start to get lazy in the machines because they've got something to sit up against.
Yeah,
they've
so
got
the
a
machines
back
providing the
rest, so they're
stability.
like, oh, you know, whatever, like I'm just gonna lift this weight. I'm like, right, well, I want you to engage the core, and they're like, oh, I'm like, well, if you engage your core in everything you do, and you're thinking about it, not only do you become a lot more stabilized in your lift or in your movement or in a machine or anything like that, you're actually strengthening that without having to deliberately put that.
Pause there for 2 seconds. Right, sorry. You were
No,
saying
all good.
about bracing core properly.
Yeah, just making sure that you're using it in every move that you're doing.
Sorry, I just had to dash outside because I'm going to sound old and miserable and that, but there's guys tidying the car park up and they're using a leaf blower and yeah, brushing a shovel might be better. Anyway.
When it's that deep, yeah. Easy, all good.
Take a deep breath. We
You
sit
tried your
calm, don't
core?
we, Copes? What do you reckon?
What do you reckon?
Move from oh, yeah, okay. Yeah, you got a 6-pack. How do you get a 6-pack?
Well, I do a lot of dancing, right? So I'm always moving. So I'm not just training my abs, I'm training a lot more movements too.
Yeah. So
You'd have a lot of balance and everything in your dancing, don't you? Yeah.
what do you have to, if you're going to be at the top of a 3 high,
Yeah.
what do you have to be very good at?
Squeezing your core so that you're not wobbling.
All right. So you,
Strong.
yeah. So that's why you've got the 6-pack you've got and the abs you've got, other than the fact that you're obviously genetically quite lean anyway. But because you've got a good core, it works better.
That's why they do PBT and stuff to help with the strength in your core and stuff. For
What's
things like
PBT?
that. So that's like stretching and stuff to loosen up your legs and for like splits and helps and abs and stuff to help with like other downfalls.
Cool. So yeah, it's not, abdominal work shouldn't just be an easy option as opposed to doing the big muscle groups. Then we'll look at the core being very, very important for all training. And then you opened with talking about not spot training.
Yeah. So spot reduction, you're not going to be able to just train abs and lose your belly fat. That comes down
No.
to diet and your nutrition.
Overall
and
body composition.
Overall, because you cannot reduce. Say you've got slightly larger, as a woman, you might have slightly larger hips or butt or legs or whatever. You cannot spot reduce just legs. You cannot spot reduce just your belly. It's overall training, overall nutrition. You're going to lean down. Unfortunately, generally speaking, you're going to lean down from your smaller limbs and then down into your body.
And would you say, so let's say you've done a fair bit of work and you're making a lot of progress in overall body composition looking leaner. Could there be an argument to be made for then training that specific area with a view to, so if you're training a certain area, let's say your biceps and you want to get that pump in there, so you're increasing blood flow and you're specifically targeting that.
Yep.
You could potentially get the same effect from those muscles in that area. But if there's a shit ton of body fat over them, you're not going to see that.
No.
Whereas obviously when it gets leaner, then you can get that pump through the abs.
Yeah. So you'd still want to, if you want abs when you get leaner, you still want to train them so that you've grown that muscle in your, what we spoke about the other day about like your bulking phase.
Hey guys, there you go.
Morning. So you still want to be able to, you can still grow your abs.
Yeah.
And you still
Just
want
like you would any other muscle.
you would any other muscle. So you still want to be able to incorporate that into your training, but you can't spot reduce that by training your abs.
Yeah.
Which is what the typical 10 years ago, probably even yesterday with some people.
You still see it.
You still hear it. You can't spot reduce. But if you want that muscle when you get leaner, then you still have to train it.
Yeah, we've definitely mentioned before, certain influencers and those types of people that talk about this routine got me these specific results. And it's like some kind of Pilates based yoga mat floor routine,
Mhm.
which is absolutely brilliant, by the way, but definitely not the reason that this person got like the muscles they got or whatever.
Yeah.
And that's kind of that thing, is like that old adage of do this and you get this result is just baloney.
Yeah. Agreed.
Cool. That kind of covers that, I think. It's pretty
Yeah.
good. Soreness in muscles being in general being an
Mhm.
indicator of
Performance /
performance
progression.
or results of
We were talking about
Soreness.
soreness. So,
accurate indicator of.
I think
It could be an indicator of
it's an
intensity.
indicator of exactly that. So, indicator of working hard enough of the intensity. But when you should be doing a program for a certain period of time to work on progressions each week. And when you're doing the same exercises for say 4 to 6 weeks, same program
Yeah.
and everything, even though you're pushing harder, heavier, more reps, whatever it might be to try and get whichever one of those it might be to try and get that progression, your muscles are getting used to the movement and you're not going to be as sore each week when you do that same exercise.
Yeah.
As soon as you go into a new program and you're doing a slightly different movement, you'll be sore again.
Yeah.
So it's not always an indicator of it working as such, but you should still have your intensity up throughout your program and things like that.
Yeah, because then you'd almost go, if you looked at your last 2 years of training and goes, and you said to yourself, how many times have I been really, really sore? And it's at set times, right? It's when you've, like you say, changed an exercise,
Mhm.
or so you're taking muscles to a different range,
Yeah.
or taking them to the same range, but then the loads at a different point of that range,
Mhm.
or you're adding differentiating a lot of volume.
Mhm.
Can be the other way.
Yeah.
Like you say, it shouldn't naturally just be every single time you should be sore. But,
Yeah.
unless
If
you're
you're training once a week,
an
you
outlier.
might. If
Yeah.
you're training once a week, you might.
I still think the body would adapt quite quickly to that, and you wouldn't get the same soreness. But
Yeah.
it's not an exact science.
But
But-
yeah, definitely not a perfect indicator
Nah,
of it working as such.
it's worth like listening to it and being aware of it. Like you say, if you have changed routine lately or added a different exercise back in, like I came away from being up north and did my first bigger leg session in, I don't know, let's just say it was 3 weeks. And I hadn't stopped, but I hadn't done hack squat for 3 weeks. And then that muscle gets re-stretched in the bottom of the hack squat again. And yes, I was sore
Yeah,
for 2
you're gonna
days
be
after,
sore,
but
yeah.
so that's, an indicator that my workout was good.
Hmm.
But if I was exactly the same soreness the week after doing the same routine, I'd be a little bit like, well, what's going on here?
Mm.
That shouldn't probably be
Quite as
not the same anyway.
yeah.
And none of which we're not looking for pain in joints.
Yeah, pain and soreness different. So DOMS, which is delayed onset muscle soreness, because you feel that that's the muscle that's a little bit sore from working it, but not joint pain, not where you might have torn a muscle.
Yeah.
Pain where you've got to stop training. Different.
Yeah, no, very different. Which also leads us into what we deal with, like a lot of the time with clients who don't potentially feel like they're doing as thorough a workout if they're not sore.
Mhm.
Some clients that don't want to get sore. And then we've
Had
got
that.
some clients that,
Want to get sore every
I
single
felt fine
time.
after that session. I'm like, perfect.
Good.
That's a good thing.
Yeah.
I want to get you to the point where I can push you and you
Yeah.
not be sore.
Not sore, but we've done this much more weight. We've done this many more reps, or we've done this from your last workout. That's pretty good. You're still progressing.
Do you get sore when you do anything? Like exercise?
Sometimes I do.
Where do you get sore? Legs?
Mostly in like my back and the legs.
Your
and
calf
stuff.
muscles.
Calf.
Yeah.
Right. And what does it normally happen after certain things,
It
or
normally happens like after that and stuff, like even after I've like done all the exercises. So I feel like it's all sort of,
Really tight.
yeah,
So that's the kind of soreness that Michelle and I are talking about.
yeah,
Yeah.
'Cause you do a bit of
Muscle
training with
soreness.
your dad, don't you?
yeah.
You don't get sore when we do stuff in here, though, do you?
Sometimes, but most of the time I'm fine.
Yeah. You're pretty good. Yeah.
To be young and recovery,
I know. Tell us about it.
but she'd run around a lot more than what we do for recovery.
For recovery, you'd be
Moving.
moving around, which would
Mm.
mitigate some of it. But it's kind of good that because that links into the whole the next bit about young people training. Now you
Mhm.
don't. You sometimes you train weights with in here, don't you?
Sometimes.
Not too much. Most of your stuff's in and around dancing.
Yeah.
But obviously we're going to talk about. It is a bit of a myth still. Is training in young people and it's stunting growth
Mhm.
and those kinds of things. Is that
Yeah, I'd
do you
have to look a little bit more into the ages in that. I think the old thing used to be about
Huh?
growth plates and things like that and stunning growth. But I mean, you've got teenage powerlifters and stuff
Yeah.
out there, like young adolescent powerlifters too. So
I would look at it from a more simplistic stance where if the whole reason we try and advocate for resistance training is for increased muscle mass,
bone mineral density.
lower body fat, bone density, tissue, ligament, cartilage, tendon, strength. All of those pro points, why would it be any different for someone that's younger in development?
Mhm.
Like it's going to have the same benefits for them.
Same.
Obviously, the
Safe
underlying
training.
the underlying rule of this is training done properly, relevant to their experience level,
Mhm.
not lifting beyond what they're capable of being stable with and those sorts of things.
Yep.
But if all those things are in place, I can't see any reason why not.
Well, yeah, exactly. I agree. Like a lot of young athletes, especially, are getting into the gym more to help with their sports.
Yeah, there's a
there's-
reason that all your sporting professional teams now have specialized S&C coaches. And those S&C coaches will be working with their junior groups right up through. It's not just, all right, okay, now you're $1 million player and you have to train in the gym. They're trying to get you to the right physical shape before you get good enough at the sport. So resistance training is not something to be scared of for, let's go like young teens basically onwards. Like, because obviously, slightly younger age, you do have to be sensible with it, but you do some resistance training and gets you strong. Doesn't get you injured. Kind of want to bulletproof them for whatever sports they are playing as well.
I mean, everything's that I remember watching you do some rap pulls in here. Got beautiful core and everything else. It's only going to make you stronger in your dance.
Yeah.
Especially when you throw high and stuff.
It's also probably worth saying that, like, resistance training in particular, or getting coached off a trainer can be a really good way of kids learning like proprioception and positive reinforcement and all those mental things that come with training properly.
Yeah, we're having this discussion only a couple of days ago. Like, as kids grow, they've got to get reused to the length of their limbs because they're going through a growth spurt and things. And a lot of the time by training, they're getting used to where their limbs actually are. It's like a baby giraffe.
Yeah.
You don't go crazy heavy that they can't control it, but you teach them that strength and you teach them how to actually feel their limbs of their body.
Yeah. And like I say, even just the fact of like on a base level, teaching the younger ones to do hard work and see reward for it.
Mm-hmm.
Because there's no
Delayed reward, not
regardless
instant
of
gratification. Like
other accusations, there's no people that are like in really, really good shape that have managed to shortcut that, like they've done the work to get that way.
Yeah.
So that's a good message to pass on to them as well.
Yeah, I agree.
So that's probably one of the biggest myths that I come across that I would say, like, it's just, like I say, it's rubbish. Done properly, it's very safe. I would even promote it.
Yeah.
And in all of that, I'm not saying that kids have to train in one specific way or one specific type of exercise.
Yeah.
Make them a well-rounded
stronger.
strong in most directions kid.
Well, I know, like, personal experience, if I had access to a gym when I was a young teenager, not that I wouldn't have had the injuries that I had, but I think it would have helped prevent them potentially.
Or less of the chances anyway.
So, like 3 knee reconstructions, like if I
Yeah.
actually was stronger in my legs, my glutes, and everything that I needed to be in my quads, hammies, I wouldn't have had as much of a chance of doing that because I would have been stronger in landing. My ligaments would have been stronger. Like,
Well, how many of
all
these
sorts of stuff, yeah.
injuries like are basically junior versions of repetitive strain injury, right? So again, training outside, so this is a little bit more athlete based, but training outside of your sport in a resistance setting is teaching things to move in all the different directions rather than just the sport specific movement. Because the sport specific movement's important for the sport, but if it's done over and over and over and over and over, you are making yourself susceptible to repetitive strain. And really, again, the data is there. There's a lot of studies in the US that you really don't need to start specializing until you're in your late teens.
Oh, yeah.
So, and even then, you know, the best coaches that I prefer to listen to in the US, for instance, wouldn't be, even with big time professional athletes, wouldn't be just getting them to do one movement set. They'd be still making them a well-rounded athlete with the ability to do this.
Yeah. Yeah, well, there's a lot more studies and stuff coming out with that. And we've spoken about it before in another episode, was just because they're easy. Basketball and netball, for example, very similar sports.
Yep.
If you look at it that way, whereas basketball you can move, netball you got to stop. But if you become proficient in both of them, you're becoming well-rounded in that type of ball sport, or even something else in soccer or whatever. But like, you become a better athlete all round.
Yeah.
By incorporating different sports and not specializing so early on.
And then you can tailor that to the adult population and just say, right, okay, you might have this pastime, or you might still be playing sport, or just starting a new hobby or sport up or something, but why not just be capable and less injury prone in general, and then tweak it to be able to perform in this direction?
Yeah. So, like where I was saying before with my 3 knee reconstructions that I had, so the muscles that I was weak with, if I had access to a gym, that actually would have definitely helped. So when I went and saw the surgeon and stuff, he's like, "Oh, you're really weak here. This is what you need to work on for your rehab after this surgery and stuff like that." So if I had access to a gym, I would have been able to work on that. I would have been able to hopefully prevent my next one.
Yeah.
But then I went back for a 3rd time, so yeah.
These things happen. How many injuries you had?
I think 3.
They weren't caused in the sport though, were they? Just accidents. Climbing.
Well, I broke my ankle because I did a side aerial.
A side aerial?
That's technically like stuff.
Yeah, just an accident then.
But then the other ones were.
No.
Not
Kids
really.
will always have accidents.
Very true.
Cool. I think we're done. I think
Easy.
we've covered those ones today.
Yeah.
Happy with that?
Yep.
You happy with that?
What?
So you get the final say today.
Don't know, maybe.
I was kind of hoping you were going to shut up. You were talking so much.
You talking wasn't me.
Yeah, that's my job. Cool. Let's go.
Maybe. Done.
Thanks, mate.
Thank you.